Congratulations on reaching 4 months of parenting. You've been doing this a while now, and hopefully you're getting a little more comfortable with it. At 4 months old, your baby may be making some cooing and gooing sounds and laughing and responding to the things that you do with her. The baby should be holding her head up when you hold her. The baby should be looking at his own hands, maybe reaching out for toys, but probably not able to grab them, just swinging at them or batting at them. But if you put a toy in your baby's hand, there's a pretty good chance she'll be able to hold on to it, at least for a short time. And she should be able to reliably push herself up and hold her head up when you lay her down for tummy time. Some babies by 4 months old have started rolling over, but most will wait till closer to 6 months old for this milestone. I generally tell parents by 4 to 6 months old, if a baby rolls over on their own, you can allow them to stay that way, but still always lay them on their back. And be sure that there's nothing in that sleep environment that could be a potential breathing hazard for the baby. At 4 months old, many babies start teething behavior. Teeth you usually don't see till close to 6 months old, but as soon as you start seeing teeth, I do want you to start brushing them. Some dentists will even say that there's benefit in brushing the gums before the teeth even come out. Usually you see the bottom 2 teeth in the front as the first teeth. Teething behavior can include drooling, wanting to chomp or bite on things. There may be some changes in the stool pattern for baby when they're teething. There is a little bit of disagreement in the medical community about whether teething actually causes fevers at all. It probably doesn't. The main point I'd want to say is that if your baby is acting sick or seems to be ill, don't just blame teething for that. Do bring them in and have them checked up by their physician. Baby still needs to be buckled safely in that car seat, in the back seat, facing the back. Some babies will kick the seat, and that's okay, as long as the baby is buckled in. And keep the baby in the appropriate car seat for their weight until their weight and size and length outgrow that car seat. Remember that babies should be back facing in a car seat until they're 2 years old. Some babies at 4 months old, 4 to 6 months old, will roll or crawl. Most babies are closer to 6 months old for the crawling, but some will start to do it as early as 4 months. And some never crawl at all. They just go right from a little scooting across the floor to standing up and walking. Now is a good time to look at the toys that you offer to your baby to make sure they are safe. Make sure there's not any pieces that can detach that could become a choking hazard. And be sure that the toys and the clothing that you use for your baby are rated for the age of your baby so that they are appropriate and they're less likely to be hazardous. I still do not recommend putting anything around the neck of a small child, as that could potentially be a choking or strangling hazard. At 4 months old, your baby will be due for another set of vaccines. If you have any questions or concerns about vaccines, please bring those to the attention of your baby's healthcare provider. Keeping babies healthy through vaccines is one of the strongest pieces of healthcare advice that we can possibly offer to you and your family about your baby. So I really encourage babies to get fully vaccinated on the correct schedule. If your baby is under 6 months old, when the flu season starts, they won't be able to get a flu vaccine until they're at least 6 months old. The best way to protect the baby from the flu is to protect everyone around them. So be sure that the rest of the family does get their flu vaccines, even if the baby cannot. This also applies to COVID-19 vaccines. The recommendations for COVID-19 vaccines are changing rapidly, so do be sure that you check with your own healthcare provider for what is recommended for you. Your baby is still getting all of the fluid and all of the nutrition that she needs from breast milk or formula. Babies under 6 months old do not need to have anything else. Babies in general shouldn't get plain water, even if the weather is hot. And baby is still not needing any solid foods till about 6 months old. Your healthcare provider can walk you through starting solid foods. I sometimes recommend that families who are willing to and motivated, start with a little baby rice cereal just a few days before their baby's 6-month checkup. The 6-month checkup is the next time that baby should be seen for a healthcare checkup. At 6 months old, the baby will need some more vaccines, but they will not be quite the same as the sets that the baby received at 2 and 4 months. Ask your healthcare provider for more details about that. If you are planning international travel and will bring your baby with you out of the country, be sure to plan ahead. Your baby may need additional vaccinations for travel, as might you. So check in with your doctor as soon as you know what your travel plans are, so that you can find out what recommendations your doctor or healthcare provider may have for your entire family during traveling. There's a lot of information involved in parenting, a lot of recommendations you need to know about, a lot of things you need to do every day. Don't get overwhelmed. If you have questions, ask your baby's healthcare provider. That's part of why the Dr. Jason channel exists. I've got lots of resources here on this channel for you to check out at your convenience as you're able to digest all of that information. Some of the most important things for your baby's health and safety include that the baby get regular medical care from a reliable healthcare professional, and that you follow their healthcare advice to keep your baby healthy through things like immunizations and keeping your baby up to date on vaccinations. I'm sure you know this, but it's my job to remind you, never, ever, ever, for any reason, ever shake a baby. That can cause irreversible harm to their nervous system and brain. If you have any questions about taking care of your baby at 4 months old, please feel free to drop those in the comments of this video. If you have questions about your baby's individual health or problems that you may be having, please bring those questions to the attention of your child's healthcare professional. Parents, you got this. See you soon. Please hit that little thumbs up to like this video, subscribe to our channel, and then hit the little bell so that you won't miss a thing.